Welcome to the Occupational Safety Leadership Podcast, episode number 108. And in today's podcast, we'll talk about chemical ingestion scenarios. You don't hear it too often, and sometimes you don't hear it often because it's not a 100% has to be done right now type of like emergency. You can't have it where chemical exposure does get inside your body. You do ingest it, and it's a low enough dose that you really don't even know it. But then the chronic effects, of course, take case too. But today we'll kind of talk about a couple of the scenarios that I've heard about. I've witnessed a few, and luckily, I witnessed a few by somebody calling me and telling me about it. Not really witnessed a few. Um, so let's just kind of dive right in. So episode number 108, chemical ingestion scenarios. So when we think about ingestion, well, first off, the chemical has to get inside of us in some fashion. So in this one, we're not going to focus on the other routes of exposure. We're just going to talk about ingestion. Um, So, ingestion of industrial chemicals can occur through various accidental or unintentional pathways. So, we'll go over a couple of scenarios, and notice that I said industrial chemicals. This can also happen with household chemicals too, but that, of course, is just such a different standard when it comes to what the individual has for training. Do they have a SDS on hand? Do they, because it's a household. So we're going to really focus more on the industrial ones that can happen. So let's look at scenario number one, the accidental swallowing. So we've all kind of imagined how this could happen in the grand scheme of things then. So this is one that a friend of mine had called and told me about. Luckily, everything worked out really good, but it could have gone awful. So let's just kind of go over this scenario. So employees may accidentally swallow chemicals if they are not cautious when handling or transferring. And of course, um, I like to think that this is going to be caused either from a lack of PPE, there's some kind of a spill, there's a leak, there's just something that's not like an everyday scenario that's out there. So, and then the case that my friend had called me on, they were transferring hydrochloric acid from a drum, the super tiny pump. So they were only trying to get half gallon here, half gallon there. So of course it's a 55-gallon drum, half gallon here, half gallon there. Um, they were having trouble with the pump. Um, the person just literally forgot it was acid. Had the power on and just thought, well, if I just take the hose off, kind of see if there's a clog in there and things. Um, and it went right into the guy's mouth. Now, luckily, it was just a couple of drops. Of course, they had the SDS. They got him first aid very quickly, follow up care at the hospital. Everything turned out great. Uh, but that was just a person who really thought they were doing right. They also did not have the proper PPE on. Um, they did have on gloves, but they chose not to wear the goggles or the face shield or any of that stuff too. And they really thought they were doing right. There's a problem with the pump. I'm just gonna fix the pump. Um, so these things can happen. Let's look at scenario two. So contaminated hands and surfaces. Then, so many times we can't tell that we have a hazardous chemical there. Sometimes you can see it, you can smell it, you can. The human nose isn't always good at smelling things. Um, and we also know that there's a lot of touching of the hand to mouth, face to mouth, all that kind of stuff. Then, so improper hand hygiene, of course, can lend itself a lot to this. And sometimes we think about it's on the food type basis. Um, Anybody who's worked in the workplace for a while knows that there are some people with spotty hygiene, and you can see people picking their nose, picking their ears, or scratching their eyes. You know, I see a lot of guys after having lunch will put their finger right inside their mouth, almost like they're getting something out or something's caught in their teeth or something like that. So improper hand hygiene, of course, typically plays a role in this scenario. Let's look at scenario three. So food and beverage, or well, food or beverage contamination. Then, so um, I've heard stories where people store their lunch right in the same places that they store these chemicals in there too. So obviously, as you're using the handle on the door, do you have the residual on your gloves? You know, so it comes from that kind of contamination of food or beverages. Then, so for the labeling, the incorrect labeling of chemicals can lead to confusion. So and then, of course, you can accidentally ingest this. So, this is one of the really awful scenarios that I heard from a friend of mine. He took over a company. The person thought they were doing right. They took some methylene chloride, and they didn't worry about having it labeled because it was going to be for personal use. They were just taking it to the workstation, going to use it right away. So they chose not to label it. The guy couldn't find a chemical bottle, so he took a Gatorade bottle and just put in some Gatorade. I'm sorry, put in some the chemical inside the Gatorade bottle, which was methylene chloride. Took it to the workstation, did a few things, got sidetracked and left. Next person came, was doing stuff on a hot day, and started to drink it. Luckily, that one worked out good too. Got him down to the hospital, got everything done very quickly. But this is another case where a person really thought they were doing right and just kind of put it in a bottle that you wouldn't think had chemical in it, of course, and it did. Scenario five, breathing and swallowing. And so we know that in the workforce that airborne chemicals might be inhaled, and at the same time as they kind of go through your mouth, into your lungs or settling in places then. So, and then as it settles, of course, it there's a lot of moisture in your mouth, your nose, all that kind of stuff then really kind of adds to as it then gets swallowed at some point in time. Then that's just another way that it can get inside of you. That is it for today's episode. We covered five chemical ingestion examples or scenarios or whatever you really want to call it. I can't stress enough the proper storage, hand hygiene. Just really work with the folks. There are people who are coming into your company with different levels of training, maybe some bad habits they're bringing from other companies too. So you also have to look at follow-on, new hire training, and all that kind of good stuff too. Then, so episode number 108, chemical ingestion scenarios, is done. Thank you for joining me today. My name is Dr. David Ayers. Thank you and have a safe day.